Hello everyone, I am Dr Shagufta working at Health and Hijama Clinic, Banaswadi, Bangalore. In today's video, we are going to learn about what is fatty liver, what are the complications, risk factors, what is grade 1, grade 2, grade 3 fatty liver, is it reversible, and if yes, what are the best methods. Let's find this out in detail in this video. Watch the complete video and find out the most effective ways to reverse fatty liver. Does your doctor say you have or may have fatty liver disease? When someone is diagnosed with fatty liver disease or hepatic steatosis, they may often wonder how it happened, why exactly did their liver get fat, and what does this mean for their quality of life. First, you should know that this is an increasingly common health problem and you don't have to drink a lot of alcohol to get it. In fact, the majority of cases have nothing to do with drinking. More and more people are developing this condition every year as a result of their lifestyle habits. Surprisingly, an estimated 20% of people living in India have some form of fatty liver, and most of them don't even know it. Many doctors refer to fatty liver disease as the fat you can't see. This is a condition characterized by an abundance of fat in the liver. Liver with a high percentage of fatty buildup are more prone to serious health problems as a result. Having too much fat in the liver is called steatosis, which by itself isn't a huge cause for concern as it is generally a benign condition. However, if the steatosis worsens over time, the liver can enlarge and start to develop scarring. This can lead to cirrhosis of the liver, which is a serious condition causing lot of problems including death. Complications usually arise when fat comprises more than 5% of a person's total liver weight. As the fat cells develop, they push the liver cells further away from each other, placing strain on the organ. Being diagnosed with a fatty liver is often an indication of future health problems to come if it is not dealt the right way. So it is important to monitor your liver health closely. After all, your liver is critical for detoxifying your body, aiding in digestion, converting food into energy, breaking down fat, and many other vital processes that your body depends on to maintain a state of optimal health and well-being. It must be lean and healthy to perform these tasks well, which means you must take proper care of it. Fatty liver disease is generally separated into two categories, alcoholic and non-alcoholic. These terms are often used to describe a range of conditions and have various levels of intensity, that is, stage 1, stage 2, and so on. Let's take a closer look at some of them now. 1. Non-alcoholic fatty liver disease, also known as NAFLD. Fatty deposits of the liver are not caused by alcohol. Patients are usually but not always overweight and sedentary. They have a poor diet, have high cholesterol, or have diabetes. Rapid weight loss can also cause it. The disease can progress to cirrhosis just like alcoholic fatty liver disease if left untreated. Note that individuals with healthy lifestyles can also get non-alcoholic fatty liver disease for unknown reasons. Damage to the liver is caused by excessive drinking, usually over many years. It is the first development of the liver disease that can turn into cirrhosis and eventually liver failure. While having a fatty liver may not cause lasting harm, non-alcoholic steatohepatitis occurs when the liver progresses from having too much fat to actually being inflamed. This is much more serious and can lead to complications if not treated. Chronic and progressive liver disease is caused by an overconsumption of alcohol. If left untreated, this will progress to cirrhosis, liver cancer, liver failure, or liver-related death. Patients are urged to stop drinking immediately. There are various factors that contribute to a decline in liver health, and some of them may be out of your hands. However, more often than not, the disease is primarily self-induced by poor health choices concerning your diet and exercises. Eating a nutrient deficient diet or drinking copious amounts of alcohol over an extended period of time are the main culprits. While there isn't a concrete answer to as why the liver gets fat specifically, the current theory points towards complications arising from insulin resistance, which is a precursor to diabetes. This can cause a cascade effect of excess glucose and fatty acids entering the bloodstream. These fatty acids then begin to accumulate in the liver. As more and more fat accumulates, the liver enlarges and permanent scarring can result. General causes of fatty liver disease include obesity, alcoholism, type 2 diabetes, hypertension, genetic inheritance, celiac disease, sudden weight loss, metabolic syndrome, hepatitis C, high cholesterol, and sometimes the side effects of prescription medication. Your liver is unable to feel pain, so spotting warning signs can be difficult. Although many people who suffer from fatty liver disease do experience abdominal pain or discomfort, this is caused by the inflammation of the liver and not by actual pain in the liver. It may also be attributed to, at least in part, to poor digestion, since having a fatty liver that cannot digest food properly can certainly lead to indigestion and abdominal symptoms. Some early warning signs of fatty liver disease include nausea, chronic fatigue, diarrhea, and a feeling of uncomfortable fullness in the upper abdomen. As you can see, these symptoms could be hard to differentiate from many things. So, if you suspect that you are having any warning signs and symptoms of fatty liver disease, you should consult a doctor and begin making lifestyle changes necessary to stop the damage immediately. Many people who have the non-alcoholic form of the disease never suffer any ill effects, while others do. The fact is, there are rarely physical symptoms of the fatty liver until it is quite advanced. This is a disease that is insidious, and people have it are often unaware of the problem until some serious symptoms occur, if ever. This makes it a silent disease. This is why it is important to take good care of your body and always monitor your health. Don't skip your yearly checkups and report any abnormalities to your physician. Any manifestations of the following symptoms, and you should not waste any time getting to a doctor. This is particularly true of pain in your upper right side, which is where your liver and gallbladder are both located. General symptoms of fatty liver disease include fatigue, increased bruising, fluid buildup in the stomach and legs, unexplained weight loss, jaundice or yellowing of the skin and eyes, mental confusion, dark patches on the skin, and pain in the liver area. There are several diagnostic tests that may be performed to identify this condition. Your doctor might want you to have one or all of them depending on the findings. Blood work. Blood test will show if there are elevations in the liver enzymes, which can include alanine aminotransferase or ALT and aspartate aminotransferase or AST. If you have high levels of ALT and or AST, it may mean that you have some type of liver damage. Imaging tests. This can be MRI or CT scan. Sometimes the doctor will want an ultrasound of the liver also. Liver biopsy. This is the only test that can definitely and conclusively diagnose the disease. A long needle is inserted through the abdominal wall into your liver, and a little piece of liver tissue is removed and then examined under a microscope. Depending on your doctor and your resources, you might opt for skipping the first two diagnostic tests and going straight for the liver biopsy. This test gets right to the heart of the matter with a definite diagnosis right away. If you are diagnosed with it, there are homeopathic treatments and cupping therapy or hijama that have proven to be effective in many people at treating and even reversing the course of the disease. You can also try a special and effective liver cleansing diet that will improve the disease along with the cupping therapy. By this point, you are probably wondering if the fatty liver can be reversed. Well, let's talk about that. The answer to this question depends on the amount of damage your liver has sustained thus far. Advanced stages of liver disease may not be reversible, unfortunately. If caught early, a fatty liver can be lean again through vigorous diets and exercise. It is hard to reverse fatty liver disease and will require your full attention. The first step is to commit yourself to eating a healthy and a liver-friendly diet along with plenty of water. Avoid alcohol, avoid high glycemic carbohydrates and foods with added sugar. Lastly, if you're overweight, immediately start working on slimming down in a slow and controlled manner. Treatments can vary depending on the severity of the condition. Cirrhosis, liver cancer, and liver failure are the serious medical conditions that can be life-threatening. Treatment options can be more limited for these advanced stages. This is why it is important to spot the symptoms of the liver disease early in the inflammation and fibrosis stages. If you are treated successfully at these stages, your liver may have a chance to heal itself and recover fully. Fortunately, there are medical and herbal treatments that can slow, halt, reverse, and even eliminate the fatty liver disease depending on how advanced it is. Currently, treatment strategies for non-alcoholic fatty liver disease consists of identifying and treating associated conditions such as diabetes and or hyperlipidemia, improving insulin resistance either by means of weight loss, exercise or medications, using antioxidants to protect against further damage to the liver. In the recent years, there has been much progress in the holistic approach to treating fatty liver disease with such things such as liver cleanse, detox and flush. Here are some suggestions about your diet that can help you slow or even halt the progression of the disease that might take place otherwise. One is eat small and frequent meals. For all practical purposes, you should eat 3 regular meals and 2 healthy snacks during the course of the day. If you are diabetic, you may also need a bedtime snack so that your glucose levels doesn't drop too low during the night. 2 is stay well hydrated. Drink at least 8 to 10 cups of water or other similar non-alcoholic beverages during the day. Keeping your body hydrated is crucial for adequate functionality of the liver and supporting organs. 3. Eat your vegetables. While you don't have to adhere to it every day, I believe that a vegetarian diet at least 2 to 3 days a week is helpful. If you're overweight, this practice will also help you lose weight, a benefit to your liver altogether. 4. Avoid fatty, fried foods and dairy products which are high in fat. Your liver must work harder to produce enough bile to digest these fats, which causes added strain to it. If you have a fatty liver, then you should consider giving up red meat since it can be more difficult to process. Instead, try eating foods that are high in fiber such as vegetables, fresh fruits, whole grain bread, rice, cereals and dried beans. Did you know that your hard-working liver is one of the most important organs in your entire body and has a big job to do in trying to keep you healthy? It is the largest organ after the skin and is in direct proportion to its role in things such as digestion, filtering harmful toxins from your body, absorbing nutrients and other critical functions necessary to your health and overall well-being. If your liver isn't healthy, you are going to experience health problems. If your liver isn't in good health, you won't be either. It's just that simple. Remember, in a lot of cases, this disease is basically benign, meaning that it never causes any serious harm to your health. However, it can progress or bring other problems that can be very serious indeed, even life-threatening. For this reason, it isn't a good idea to just simply go on ignoring your condition. To play it safe and stay healthy, you need to make some adjustments to your diet and lifestyle and check in with your doctor regularly. Here are some suggestions for home treatments of fatty liver disease or hepatic steatosis. 1. If you drink alcohol, stop. 2. If you smoke, stop. 3. If you're overweight, lose that weight, but do it slowly and naturally. 4. If you're out of shape, do exercise. 5. Keep your cholesterol levels at or below normal. 6. Monitor and normalize your glucose levels. 7. Avoid harmful substances such as drugs, fast foods and junk foods. The worst case scenario with this disease is that it could progress to the point where a liver transplant is your only option. Grade 1 fatty liver, also known as the mild fatty liver or grade 1 hepatic steatosis, is a condition where there is small amount of fat accumulation in the liver cells. Fortunately, grade 1 liver cell is totally reversible in most cases with lifestyle changes. However, if left untreated, there is a risk that the condition could progress. Grade 1 fatty liver can develop into more severe stages of fatty liver, such as grade 2 or grade 3 fatty liver, which involve higher levels of fat accumulation and potential inflammation. Inflammation of the liver, known as non-alcoholic steatohepatitis, can lead to more serious liver-related complications over the time, including fibrosis, which is an inflammation which can lead to scarring of the liver tissue, known as fibrosis. As fibrosis progresses, it can impair liver function and potentially lead to cirrhosis. 2 is cirrhosis. This is the advanced scarring of the liver tissue, where healthy tissue is replaced by a scar tissue. Cirrhosis can lead to a range of serious health problems, including portal hypertension, liver failure, and an increased risk of liver cancer. 3. Liver cancer. Chronic inflammation and cirrhosis are the risk factors for the development of liver cancer, also known as hepatocellular carcinoma. Weight loss can significantly improve fatty liver disease as it can reduce the amount of fat stored in the liver. Aim to lose weight gradually, as rapid weight loss can be harmful for liver function. Grade 1 fatty liver is when there is 5% to 33% fat in the liver. Grade 2 fatty liver, this stage is marked by 34% to 66% fat accumulation in the liver. Grade 3 fatty liver, this is the severe grade wherein more than 66% of the fat is accumulated in the liver. This is the final stage of the fatty liver disease. If not treated on time, the disease will turn to cirrhosis or even liver cancer and can lead to rapid death. Well, prevention is always better than cure. Take care of your liver well by giving regular detox sessions with Hijama or cupping therapy, and you can cleanse your liver with the most effective way possible, that is through cupping. And even if you are diagnosed with grade 1 or grade 2 fatty liver, do not worry, because Hijama can help you reverse the condition and you can keep your liver happy by eliminating the fatty deposits. So that's it for this video. I hope it was informative and helpful. Your comments and likes will help a lot in understanding if it was understandable. So until my next video, stay healthy and stay happy. Bye bye.